Hey future doctors, nurses, and healthcare enthusiasts. Welcome back to Explaining Insights by Roy. Today we're kicking off an absolutely critical series that every medical student, every budding healthcare professional, and even those just curious about health must understand: hypertensive disorders in pregnancy. Why is this so important? Because these conditions affect a significant number of pregnancies globally, posing serious risks to both the mother and the baby. It's a complex, challenging, yet incredibly fascinating and vital area of obstetrics. In this very first video of our series, we're going to lay down the foundational knowledge. We'll cover, first, a clear definition of what constitutes hypertension during pregnancy. Second, we'll briefly touch upon the various classifications of these disorders, because understanding the type is the first step towards proper management. And finally, I'll give you a roadmap of what's coming in the rest of this comprehensive series, so you know exactly what to expect. Let's start with the basics. What exactly is hypertension in pregnancy? Broadly speaking, it's defined as a systolic blood pressure of greater than or equal to 140 millimeters of mercury, or a diastolic blood pressure of greater than or equal to 90 millimeters of mercury. Crucially, these readings need to be on two separate occasions, at least 4 to 6 hours apart, and they must occur after 20 weeks of gestation in a previously normotensive woman. So single elevated readings aren't enough for diagnosis. We need consistency. And pay attention to the after 20 weeks part. That's a key differentiator we'll explore later. It's also vital to recognize severe range hypertension, which is greater than or equal to 160/110 mmHg. This is an urgent situation requiring immediate attention. Now, one of the first things you learn in this topic is that not all high blood pressure in pregnancy is the same. We classify these conditions into 5 main categories, and distinguishing them is vital for appropriate management. We have gestational hypertension, high BP developing after 20 weeks, without proteinuria or other signs of organ dysfunction. Pre-eclampsia, this is the big one. High BP after 20 weeks, accompanied by proteinuria or other signs of end-organ damage. We'll spend a lot of time on this one. Eclampsia, the dreaded complication, pre-eclampsia complicated by seizures. Chronic hypertension, high BP that was present before pregnancy or diagnosed before 20 weeks gestation. Chronic hypertension with superimposed pre-eclampsia, when a woman with chronic hypertension develops new-onset proteinuria or worsening features of preeclampsia. Don't worry if these sound a bit confusing now. We'll break down each one in detail in the upcoming videos. So, what can you expect from the rest of this series? Get ready for a deep dive. In our next video, we'll unravel the complex pathophysiology of preeclampsia, understanding why it happens from abnormal placentation to endothelial dysfunction and key risk factors. Then, we'll move on to clinical presentation and diagnosis, learning to identify the signs and symptoms and the crucial lab investigations. Following that, we'll tackle the management of preeclampsia, distinguishing between mild and severe forms, including the critical role of medications like magnesium sulfate. We'll also dedicate a full video to the most severe complications, eclampsia and HELLP Syndrome, focusing on their emergency management. And finally, we'll cover chronic hypertension in pregnancy and the tricky diagnosis of superimposed preeclampsia. By the end of this series, you'll have a solid, comprehensive understanding of these vital obstetric conditions. So, if you're ready to master hypertensive disorders in pregnancy, make sure you hit that subscribe button and ring the notification bell so you don't miss any part of this essential series. If you found this introduction helpful, please give it a thumbs up and share it with your study partners. Every like and share helps us reach more learners. Got any initial questions or topics you're particularly excited about? Let me know in the comments below. Next up, preeclampsia, pathophysiology and risk factors. You won't want to miss it. Thanks for watching, and I'll see you in the next video. Stay curious, keep learning.